This is Dr. Hall with Upper Cervical Healthcare of Los Angeles and Carson. Today we have Dominique Doyle with us. She's been a patient for about 2 years, and she's going to tell you how she ended up in the office and what happened following getting upper cervical care for the last 2 years.
All right, well, thank you. So I had been having migraine pain for probably about 20 years before I found you. It was to the point where work was really hard to do. I just have to lay down and take as many naps as I could. I was on a lot of medication for it, which completely knocked me out, made me drowsy. I remember one time where I was even in a dark parking lot and I couldn't even turn my neck enough to see what was going on. I was like, okay, this is getting worse. And I thought I'd gone to acupuncturists. I had gone to quite frequently massage therapy for the back of my neck, and nothing was treating it. I'd gone to chiropractors to work on my lower back. Nothing was treating it, and it got to the point where I was on a 12-day migraine, and I'd gone to the ER and had multiple injections to get rid of the pain, and a friend of mine referred me to you, and it was honestly amazing. It was such a subtle adjustment. I'm like, nothing's gonna happen from this because it was just so gentle. But that night, it was almost like a release of pain, and my neck would move, freely. And now I'm to the point where I've been seeing you for 2 years now that I can feel any slight misalignment, and I get that when I'm traveling. I travel a lot, so after a long airplane ride, I can feel when I get misaligned, and then I just come in to see you, and I'm fine for several months after that until I get another bad flight and no one to come in. Wow.
So, how many migraines have you had in the last 6 months?
One.
So, how many migraines were you having in a typical year prior to getting under care?
I was I'm thinking about how many migraine pills I was taking a month, and I was probably taking about 10 to 12 a month.
Oh, wow.
Yeah, so 10 to 12 days a month I was getting migraines. Yeah.
So thanks for your story. I just want to say one thing. Dominique touched on something, and that is I know a lot of people out there are scared of chiropractic, and the reason, and I was prior to when I was referred 28 years ago, and they're scared because of the neck twisting thing. So with the Blair work, as Dominique mentioned, most people when they get their first correction, they think that nothing happened because there's no twisting, there's no popping, there's no pulling. It's a very specific, subtle force that's delivered into a 2-ounce bone at the base of the skull to get the segment back in position. And then the most important thing that we do is we only adjust you if the objective findings show that it's off. And so we have an old saying, holding is healing. So Dominique, thank you for sharing your story.